Welcome, everyone, members and board members of the National Council on Interpreting in Healthcare. I'm Eliana Lobo, Chair of Standards and Training Committee, and I will be giving the reports for Home for Trainers, Languages of Limited Diffusion, and National Standards of Practice. So let's start with Home for Trainers. Our webinar work group added 7 new topics to the webinar series for interpreter trainers, bringing our total of topics in the series to 45. The most recent webinars focused on an array of topics for trainers, including a panel discussion on quickly adapting training programs in response to pandemic protocols, teaching trainers about the intersection of healthcare and educational settings, mental health and forensic evaluations for immigrants, and interpreter self-care and well-being, just to highlight a few. You can view a complete list of all of our webinars in the series by going to ncihc.org and clicking the webinars section under the Home for Trainers menu. The webinars work group also expanded its target audience by presenting topics for managers of interpreter services and played a supportive role in assisting the NCIHC in presenting webinar presentations related to COVID-19 pandemic and changes in the Executive Order 1557. Recordings of these 5 additional webinars are accessible under the Resources menu on ncihc.org. The webinar series continues to offer pre-approved continuing education for interpreters through CCHI. 2 topics in the COVID-19 series offer CEs through RID. 6 recorded topics were also approved for IMIA CEUs. We will continue to apply for CE approval from CCHI and IMIA for all future topics that meet CE criteria. Offering continuing education through RID is being assessed. We encourage ASL interpreters to use the PINRA, P-I-N-R-A process in the meantime. We will continue to monitor the continuing education needs of the webinar attendees to assess relevant CE offerings. We have seen a steady increase in the number of registrants and attendees of the live webinar broadcasts and in the number of views for the webinar recordings. One of our group's biggest challenges has been maintaining and expanding the webinar series while managing through several transitions behind the scenes. Our group made 2 major platform transitions that impacted the live webinar broadcast and the recorded webinar archives. These changes have resulted in improvements in the webinar experience for attendees and guest presenters, and they have also resulted in cost savings for NCIHC. At the end of 2019, our work group went from 9 members to a current 5, all of whom are incredibly talented and dedicated professionals. The current members are Jane Miller, Jaime Fatas Cabeza, Rachel Herring, Andrea Henry, the fabulous Erin Rosales, who leads the group, and yours truly. As our work group number has decreased, the number of requests for webinar certificates has increased significantly, especially for the recorded webinars. We made some immediate changes to streamline the process for issuing certificates for both live and recorded webinars while adhering to requirements to issue certificates for continuing education purposes. We are investigating the possibility of utilizing an automated process to issue certificates for viewing recorded webinars. In the meantime, the group will continue to process the certificate requests as efficiently as possible. We hope this comes as good news to the hundreds of NCIHC members and non-members who request certificates. The work group is very grateful for the practical and moral support it has received from the NCIHC board, the executive committee, the outreach committee, and the other standards and training subcommittees, and the NCIHC administrative assistant, previously Nicole Steen, and currently the fabulous Amy Niven. As you can see, the webinar series relies on the collaborative support and efforts of many volunteers. The work group is especially grateful to the subject matter experts, guest trainers, and guest panelists who so generously contributed relevant, practical, and high-quality topics to the webinar series. If you have attended any of the live or recorded webinars, thank you. Your growing support for the Home for Trainers webinar series is what keeps us going and growing. If you haven't checked out the webinar presentations yet, we hope that you will consider doing so. Looking to the future, we have a robust lineup of topics and presenters planned for 2021. Stay tuned to the NCIHC social media and email announcements for specific details. We will look forward to continuing to contribute to NCIHC's mission through this initiative for a very long time. As you can glean from this brief report, one 90-minute webinar requires many hours of time and talent and expertise contributed by many dedicated people. It is truly a collaborative effort to offer these webinars to NCIHC members and non-members. To learn more about becoming an active member of the webinar work group, many hands make light work, and we'd love to hear from you. Email trainerswebinars@ncihc.org. Thank you, and we look forward to seeing you at upcoming webinars. Now, the Languages of Limited Diffusion group has a shorter message because they're currently in a state of suspended animation, or should I say hibernation. They're on sabbatical, at least with regard to holding meetings or planning new activities. The LLD continues to maintain Languages of Limited Diffusion resource database on the NCIHC data website. If people have any resources to add, please send it to lld@ncihc.org. If we can encourage 3 or 4 more people to join the group, we'll start being active again. So just a few more folks. And you don't have to be a speaker of a language of limited diffusion. Just be interested and willing to spend some time contributing your time and talent to carry out projects. So use the same email, lld@ncihc.org. Now, I'm not going to say the best for last because all the groups are great, but National Standards of Practice Work Group is very pleased to announce the publication of Interpreter Advocacy in Healthcare Encounters, a Closer Look. The question of whether healthcare interpreters should advocate and when or how they should do it has long been discussed among interpreters, trainers, and other stakeholders. For many years, focus groups, surveys, and professional conferences have shown that a range of perspectives continues to exist. Some of you may have participated in the 2015 AMM Language Access Cafe discussions of advocacy. After gathering input and perspectives, after much discussion and analysis, many drafts and rewrites, the work is complete. The goal of the paper is to clear up confusion around the legitimacy of advocacy and its implementation in the healthcare and interpreting profession. To achieve this goal, the paper dispels some misconceptions about advocacy in the healthcare interpreting encounter, clarifies what advocacy is and is not, and describes in detail when and how it is best carried out within the interpreted healthcare encounter. The board recognizes the contributions of all the members of the work group, past and present, and would especially like to acknowledge these contributors who are with us today: Jane Contreras, Catherine Langwin, Analia Lang, and especially Maria Paz Avery, lead author. Thank you so much. And thank you, all of you, membership, for your presence, your support, your communication. It's you that make this organization work. So have a great AMM.
Hello. All right, so the Policy Education and Research Committee serves in an advisory capacity to assist organizations and individuals that want to carry out educational and research activities.
It also tracks and responds to policy initiatives affecting interpreters and/or limited English proficiency, deaf and hard of hearing individuals while promoting dialogue regarding research in language access and healthcare.
After being reorganized in early 2020 through unanimous board approval, the current team of volunteers have supported NCIHC's mission through the creation of 3 work groups. This includes policy, journal, and research.
In the policy work group, we've worked on a number of initiatives this year, responding to needs of the board or of the organization. In one initiative, we responded to allegations of mistreatment for women that were being held in detention centers along the border. We also worked on a research and writing project involving recent legislation in California for contract interpreters and translators. And most recently responded to a desire to make a statement about discrimination and racial bias against Asian Americans. And over the next year, we look forward to receiving requests and participations. If any of you have any policy initiatives that you would like our group to respond to, we'll be reporting out and hoping to receive respond to any needs that you might have.
And in the last year and during this year too, we have reviewed how the COVID pandemic has impacted healthcare interpreters in the US and developed a comprehensive survey to poll interpreters and better understand how the pandemic is affecting us and what tools and resources are most needed.
We invite anyone who has not had an opportunity to participate in the survey and click on the link shared in the chat to participate in the survey and share it with other healthcare interpreters. The survey takes no more than 30 minutes to complete, and it closes on April 11, and the results will be analyzed and shared by our work group this year.
Some of our findings will also be included in the Council's journal. The journal work group was reinstated by the board in 2020.
Over the last year, our journal work group team has been working to put together an issue to address many of the topics that many of you indicated are of interest to you.
We hope the issue we published this year, our first issue, provides you the value you're looking for in a journal and the information that will help us further the Council's mission to promote and enhance language access in healthcare in the United States.
So much, and we hope that you will join our committee and help us move forward with these initiatives.
Hi, I'm Erica Shell Castro, and I'm the Vice President of the NCIHC Board, and I'm also the Chair of the Membership and Outreach Committee. And I'd like to introduce you to the other members of our committee. We have Ceci Fillon Stiles, she's co-chair, Rosemary Ford, Tim Moriarty, Lynette Reap, Kevin Cunningham, and Carla Fogerin. So we've had several projects that we've been working on. First, we worked on getting ourselves oriented to putting valuable content on our social media platforms and learning about our social media platforms and how to effectively leverage them. And we are currently using Pinterest, LinkedIn, Facebook, Twitter, and Instagram. So please follow us on those platforms. We also needed to hire a new remote administrative assistant. And I want to thank Nicole Steen for her 7 years of service to the council. And I want to let you know that we hired Amy Niven. She's our new remote administrative assistant, and she's wonderful. She's proved to be invaluable to the council and has been instrumental in helping us to update and reorganize our webpage. And that's another project that we've been working on. We wanted it to be easier to navigate and to find valuable information. And so if you've visited our website, you'll see that it's currently under construction. And we are in the process of just making lots of different changes and organizing and making it more visually appealing. If you have any suggestions for us, and we would love to hear back from you. So you can contact us at info@ncihc.org. So our next big project has been to do a membership campaign. And we've gotten feedback that some of our corporate or nonprofit members didn't always feel appreciated. And we want to make sure that we express our appreciation to our members. And we wanted to make sure that people understand the value of our membership. And so some of the things that are included in our membership are you get webinars that have CEUs, and you can watch them in real time, or you can go back through the catalog and you can watch them on your own time. And there are just wonderful topics in our webinars, and it's a huge asset, whether you're a manager of interpreters or whether you're an individual interpreter looking for CEUs. And for the price of your membership, you get tons and tons of webinars. We also have a job board. You get to do amazing professional networking. And we have a listserv, which has been, I know as when I've been a language services manager, it was incredibly helpful for me. We do surveys and share that information that we glean from those. You're able to vote for the board, and we have a free Home for Trainers webinar, and that's really has a lot of really valuable content. So we're working on creating groups on our MemberClicks platform that would be specific either to languages or to a role like being a manager or director, or it also could be for different other kinds of member groups that you would want to see. And we're looking forward to, we're going to be doing a survey to ask you how you would like us to set that up and what kinds of topics that you would like us to focus on in those different groups. So that will be coming soon. You also get to attend the AMM. And I have to say that I've only missed one AMM. That was the one in Las Vegas. And it was because I was 9 months pregnant. But I love the AMM because I get to be with the best and the brightest and people who are as passionate about language services as I am. And the roundtable discussions are really a highlight. I've been to all kinds of conferences and, I've certainly been to many wonderful presentations, but the roundtable discussions are so rich and so vibrant. And I've come away with so much really great information. And so I also think that knowing that you're part of a professional organization that's out there advocating for language access to all is very important for us as professionals. We also have papers on there, and we just finished one. We did a survey on COVID and how it affected interpreters. We have papers on advocacy and the role of advocacy, and we're getting ready to publish a journal, which will be really cutting edge on everything that has to do with language access. So all of these things are a benefit of membership. I also encourage you, if you are interested in being more involved with the council, to consider joining one of the committees. We have many committees that you can choose from, and we're a very welcoming group, and you get to be side by side with people who care about the same things that you care about. And we will benefit from having you share your knowledge and your expertise with us. So I thank you, and there's lots of good things coming from our Membership and Outreach Committee, and we look forward to serving you. Thank you.
Hello, everybody. Cindy Rote here with a quick look at the National Council's financials, and we are doing really well. Let's take a look. If we just look at 2020, we had over $47,000 worth of income last year. Most of it, as you can see, from membership fees. So you all are helping us do the work that we are trying to do. A little bit came in for registration fees for the webinars, and a little bit in donations. If we look at our expenses, you can see that our biggest expenses were for our administrative assistant last year, some contracted work that we had done. This was through a grant that we got. We managed the grant, we contracted the work out, and we kept a chunk, which went into the National Council's coffers. Our other big expenses are office expenses, which basically are all of the software that we use to keep an online presence, and our website operation, which again is how we keep communicating with you. Bottom line is, as of January 1st, 2020, we had almost $144,000 in the bank. We made about $3,000 for the year. And at the end of the year, we had about $147,000. And as of March 31st, we're currently looking at about $162,000 in the bank. And that means that we have a fair amount of leeway with which to proceed with important projects during 2021. As you may know, all of our work essentially, with one exception, is volunteer. And so what we spend money on is basically what keeps us up and running online and in communication with you all, and allows us to do with volunteer work all of the important projects that we have going. If you're interested in looking at more numbers, you can take a look at the 2020 financial reports, which are up on the NCIHC website. In the meanwhile, don't forget to update your membership fee, because that's what's funding a lot of our work. Thanks a lot.